Good morning all. Today we'll be discussing about the topic anatomy of pulp space. In first year BDS itself, you have learned about the morphology of the tooth, as you can see in the picture in the left. You know about the crown, how many roots are there. In the crown itself, what is occlusal aspect, buccal aspect, lingual aspect, how many cusps are there. So this outline or the knowledge of morphology is there. Now, in fourth year, you are supposed to know the internal space anatomy, or the terminology we can say is pulp space anatomy, as mentioned in Kogan book, or else we can just say root canal anatomy. Knowing this is very important because certain chapters or the procedures what you are going to do in future will be dependent on the knowledge of this internal space anatomy. You should have a sound knowledge of the internal space anatomy. Like we know, any surgeon, if they want to do a surgery, they should know an in and out, in-depth knowledge about the anatomy of the body. If you're a head and neck surgeon, you must know what all muscles, what all nerves, what all vessels run in a specific region. When a patient comes to you with a complaint itself, you should know that it's because of so and so region or some damage to these tissues that he's having that pain. Once you know this, and if you plan for a surgery in that region, you must know right from starting from the outer surface skin to the superficial fascia, deep fascia, and all the muscles, nerves, vessels, whatever is underlying that. So as to do a surgery only addressing the issue without causing any harm to the surrounding tissues. In similar way, to do the root canal treatment, one of the basic procedures which is there in the endodontics, to do this root canal treatment, you should know what are the different parts and the internal anatomy. We have discussed that the trigeminal nerve. In the left-hand picture, you can see the trigeminal nerve, the three divisions of it, the ophthalmic nerve, maxillary, and mandibular. The maxillary, as you can see in the picture, is supplying the maxillary teeth, and the mandibular nerve divides into inferior alveolar nerve and lingual nerve, and these supply the lower tooth. And all these nerve fibers, as you can see in the second pictures, enter to the root through an opening, which is known as apical foramen. We'll learn in detail about different terminologies. Through the apical foramen, these blood vessels, nerves enter to the tooth structure and supply the tooth structure. This is what gives the vitality of the tooth and the sensory, different sensations in the tooth. When you have hot and cold food, you feel it as heat and cold because of this presence of these nerve fibers. And these are present inside the pulp, outer layer being the enamel and the dentine. This slide I have just added to tell you that we have learned about the histology and development of tooth in first year. You can see that the outer enamel layer and the inner enamel layer first forms, and then this continues into different stages, like starts in the bud stage, cap stage, and then in the initial and the advanced bell stages, the crown formation occurs. Now, in the enamel organ develops to form the external enamel and dentine, and the dental papilla, what is there inside, forms the dental pulp. Like you can see in the last picture or the third picture, the dental papilla takes the shape of whatever the enamel organ has already taken the shape. The same crown form is just reflected inside the dental papilla. The same way, if you see a tooth, the morphology of the tooth, the same anatomy is reflected in the internal anatomy. This point I would like to tell, so that suppose if you're confused, like what will be the internal anatomy, just observe the external anatomy. It almost takes the shape, or the outer morphology reflects the internal anatomy. So this is how the external anatomy, how many cusps, lobes from which it is developed, the same thing pulp horns will be there inside. The shape of the pulp chamber will be according to the shape of the crown. And the number of roots and the number of canal set also depending upon the morphology. So if you know the morphology, you will have some idea about the internal anatomy. Not every detail, but at least you will have a rough idea about how the internal anatomy will be. But you need to know certain more terminologies when it comes to pulp space anatomy, which we'll be learning now. Observe the picture in the right hand side. The whole tooth is divided into crown and the root. The portion of the pulp, you can see the enamel, dentin and the pulp. The portion of the pulp what is there inside the crown is called as pulp chamber. And the portion of the pulp that is present inside the root canal is known as the root canal. Root is known as the root canal. Okay. So the whole pulp chamber and the root canal constitute to form the root canal system or the pulp space. This differs from each individual tooth. According to the morphology, same way internal anatomy also differs. From the central incisor to the third molar, this is slightly different from each tooth. And even from person to person also, some amount of variations will be there. Now we will learn the most common and normal variation. In the pulp chamber itself, you can see that there are some accentuations under each cusp. These are under the lobes or the each cusp. There is some accentuation of the pulp chamber, which are called as pulp cone. And the pulp chamber has a roof, has a floor, and 4 walls. Now, this pulp chamber is continuous with the root canal through an opening over here, or there is a slight division. At the CJ level, there is a division between the pulp chamber and the root canal, which are known as root canal orifices. Now, from the root canal orifice, the main canal continues and exits at the apical foramen. We learn about the anatomy of the apical third in detail. Just know that the exit, wherever the blood vessels and nerve exit into the periodontium, is called as apical foramen, the major aperture through which it emerges. Now, any canal which is emerging from the main canal to the periodontium is known as accessory canals, and the foramen of this is called as accessory foramen. So there is a main canal. There can be accessory canals like this with accessory foramen. The amount of dentin present between the main canal and the accessory canal, similar, it's almost triangular in shape, or it is similar to the Greek letter delta. So it is known as apical delta. And there are lateral canals and furcation canal named according to the area to which it exits. Lateral canals are present almost in the middle of the tooth, exiting into the periodontium, almost in a horizontal or slightly oblique direction. Furcation canals are the one which exit into from the pulp chamber to the furcation region. So these are the basic terminologies in the root canal system. Here there is a picture you can see in the left side, which shows the pulp chamber, which is cut at the cross section of the pulp chamber, cut at the CJ level. Here we can see the orifices, different orifices at the floor of the pulp chamber. This is again one more picture is there on the top showing the orifices of the picture. In a single rooted tooth, it is the anatomy is simpler, being one pulp chamber continuous with the root canal exiting at the foramen. Whereas in a multi-rooted tooth, you can see a pulp chamber is almost in box shape with a roof, floor, and 4 walls, and then exiting into the root from the orifice and exiting from the apical foramen to the surrounding bone structure. Coronal pulp is located centrally. We have already seen the picture. Coronal pulp is located centrally with pulp cones. There are 6 surfaces, roof, floor, and the 4 walls. Dentinal maps are present in the floor. In the earlier picture, you can see that there are slight lines which is connecting from one orifice to other, which is otherwise called as dentinal map. This can act as a guideline to find out the orifice if you are missing out some root canal. This will be dealt in detail in the access cavity chapter. The pulp horns are the projections or prolongations of the roof of the pulp corresponding to major cusps or lobes. Radicular pulp is that pulp extending from cervical region of the crown to the root apex. There are different terminologies which you should know here: accessory canal, lateral canal, apical delta, furcation canal, and isthmus. In the apical third, I'm just repeating, this is the main canal, and then this is the accessory canal, the apical foramen, the accessory foramen. The triangular piece of dentin present between these two is the apical delta. And in the apical third, you should know one more thing. The canal continues and then forms a constriction. Before exiting into the periodontium, the main canal forms a constriction and then flares out to be the major apical diameter or the apical foramen. This constriction is known as minor apical diameter. So the constriction at the end of the main canal before exiting as apical foramen is known as apical constriction or minor apical diameter, and then it flares and continues to form the apical foramen or the major apical diameter. The cemento-dentinal junction sometimes coincide with the major apical, the minor apical diameter, or maybe 0.5 to 1 mm within the range of this minor apical diameter. So we'll just go through the terminologies once again. Root canal system is the entire space in the dentin where the pulp is housed is called the root canal system. Pulp chamber is the part of the root canal system located in the anatomic crown, and part of the root canal system which is located in the anatomic root is pulp canal. The whole thing is called as pulp space or the root canal system. Pulp horn is the accentuation of the roof of the pulp chamber directly under the cusp or the developmental lobe. Canal orifices are the openings in the floor of the pulp chamber leading into the root canals or pulp space. Accessory canals are minute canals that extend in a horizontal, lateral, or vertical direction from the pulp to the periodontium. These can be called as lateral canals, furcation canals. All these are different accessory canals only. Furcation canals are seen in the bifurcation or the trifurcation of the multi-rooted teeth. Apical foramen is an aperture. Now, different definitions given by different authors are mentioned over here. You may learn any of the things which are comfortable for you. Apical foramen is otherwise called as major apical diameter. It's an aperture at or near the apex of the root through which the blood vessels and nerves enter or leave the pulp cavity according to Grossman. According to Cohen, is a circumference or rounded edge like a funnel or crater that differentiates the termination of the cemental canal from the exterior surface of the root. Apical constriction, or otherwise called as minor apical diameter, it is the part of the root canal with the smallest apical diameter. Now, the significance of this point is it is also the reference point the clinician uses most often as the apical termination for cleaning, shaping, and obturation, which are the different steps of root canal treatment. Now, this point is important because it is at this point that we stop our cleaning and shaping. The working line determination is done up to here, then followed by cleaning and shaping and the obturation. Now, hereafter, after pulp space anatomy, you'll be learning the different chapters or the different steps in the root canal treatment, starting from apical access cavity to the obturation and the post-endodontic restoration. At all these points, you must remember this landmark, apical constriction or minor apical diameter. CDJ, more or less, it coincides with the apical constriction. It is a point in the canal where cementum meets the dentin. It is a point where the pulp tissue ends and the periodontal tissue begins. Isthmus. Now, whenever there is a multi-rooted tooth or multi-canals are there can be, it's not a separate entity always. There can be a thin strand of pulp tissue connecting these two orifices or the two canals, which is called as isthmus. Isthmus generally means narrow communication. Isthmus is in endodontics is a narrow ribbon-shaped communication between two root canals that contain pulp or pulpily derived tissue. This is also clinically relevant because it's not as easy as cleaning a round or oval shaped canal. Whenever isthmus is present, you have to do additional steps in the cleaning and shaping to get the area cleaned. Now, from classification onwards, we'll see in the next session. Thank you.